health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Heckler.
And I'm Tandi Heckler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. So Tandi, what's on our wellness radar for today?
Hello, and welcome to the Rev Up Health podcast. I'm Tandi.
And I'm Dr. Mark.
And today we are going to be talking about gut health. This is something that Dr. Mark has been talking with a lot of patients about recently, and he's done a lot of extra research, kind of taking a deep dive. So let's get to it.
All right. We'd like to talk to you basically about what makes up our gut microbiome. Our gut microbiome, I like to use the analogy that's like a sophisticated symphony orchestra that is made up of all kinds of different things: strings, horns, woodwinds, percussion. But all of these individual things and all these individual instruments all have to play a part with each other, and they all have to get along perfectly to have a beautiful song that comes out. And you can also think of the fact that you are the conductor of this symphony. You get to choose what happens. You get to choose how good the sound and the music is going to be by what you essentially do or expose yourself to, whether it be the environment, toxins, and of course what we eat. So all of this is something that you are the conductor in. And all these little gut microbiomes are basically just trillions of microorganisms. They're made up of combinations of good bacteria and bad bacteria. And then we've got viruses, fungi, and archaea. So all these little fellas get along, and how they live in a symbiotic relationship will determine how healthy you actually are. But these bacteria, they just basically are digesters. So they will digest all of our complex carbs and fiber, basically nutrients and things that are just indigestible by humans. And so they'll make it so our gut can absorb them for nutrients, which is kind of crazy. So if there's an imbalance, is what we call as dysbiosis. So the imbalance of this gut microbial community is what can happen when we run out of having a difficulty with what we eat and how we get along. But this affects 70 million Americans per year, which is kind of incredible. But these little guys are just immune regulators. They help to educate and modulate our immune system by training it to distinguish between good and harmful things. So this harmful stuff, basically can lead to autoimmune disease. It's a whole symphony, a whole triggered cascade of events that happens that leads to that. But you've got about 70 to 80% of your immune system is in your gut. It's called the gut-associated lymphoid tissue. And they're the regulators of how well you get along with the outside community. So it's basically these bacteria will also lead to synthesis of certain vitamins even. You got vitamins K, biotin, folate, and B12 even. So, but they take fiber and just break it down into short-chain fatty acids, which have been known to be an anti-inflammatory agent as well as boost our immunity. But these bacteria, they have a lot to do with our energy and our metabolism. They'll help with our insulin sensitivity, our glucose homeostasis, and even our lipid metabolism. But the mitochondrial, they'll also add in mitochondrial biogenesis help. But this is done by signals of nutrient availability and demand for our mitochondria. But this dysbiosis essentially will lead to a lot of chronic inflammation from various different cytokines and metabolites that are secreted into our immune system, and that impairs our mitochondrial function.
So there are a lot of chronic diseases that are caused or are worsened by gut dysbiosis. It's linked to numerous chronic health conditions, including inflammatory bowel diseases like Crohn's or ulcerative colitis, There's irritable bowel syndrome, which includes symptoms, just abdominal pain, bloating, stool changes. Metabolic syndromes are also related to this dysbiosis. So how you know that you have metabolic syndrome is an increased waist size, greater than 35 for females, greater than 40 for males, elevated LDLs over 150, low HDLs under 40, high blood pressure, fasting glucose higher than 100, type 2 diabetes, cardiovascular disease, NAFD, which is non-alcoholic fatty liver disease, allergic and atopic conditions like asthma, eczema, food allergies. Dr. Mark already talked about the autoimmune diseases and how dysbiosis plays in that. Neurological disorders also, Parkinson's, Alzheimer's, MS, depression, anxiety, which then also leads us to discuss the gut-brain connection, which is a big topic these days.
Right. Yeah, that's basically, our gut health influences your mood and hormone balance through ways of, it also affects your cortisol levels, affects your insulin sensitivity and resistance, the hormones that deal with our satiety or our hunger, which are leptin and ghrelin, serotonin and levels, as well as dopamine, GABA, and these short-chain fatty acids. But all these influence our mood, and that certainly affects, your anxiety, depression, stress, and even your cognition. And there's even, talk about how the 10th cranial nerve, the vagus nerve, is affected, from a rest and digest standpoint with our parasympathetic nervous system. And then we talk about this triad of metabolic harmony, is what I like to call it. It's essentially the gut, thyroid, and energy trilogy. So you've got, if you have thyroid problems, obviously you can have problems with fatigue or weight gain, sluggishness, even constipation and bloating. So this all can be related to our thyroid. Hypothyroidism, which is also something that will cause a decrease in motility. And it doesn't necessarily have to be a label of hypothyroidism. You can have suboptimal levels of your thyroid. So you may have normal levels, but it's just not getting into the cell, whether it be from the sludge that gets around our cells or just the receptors that get bound up. And so that tends to reduce our thyroid optimization. But, optimizing our thyroid will support your immune homeostasis. It helps to reduce gut autoimmune diseases like celiac and inflammatory bowel disease. But intestinal permeability, kind of also known as leaky gut, that type of problem allows bacteria and toxins to literally go straight into the bloodstream, triggering, inflammatory processes and autoimmune diseases. So a lot of the things that we'll see from autoimmune standpoint may be triggered from this leaky gut problem. Then we've got the impacts of the gut microbiome on our sex hormone production and levels. So, you've got a direct effect with the estrogen, also known as the estrobiome, essentially. So there's different types of enzymes that basically deconjugate estrogens in the gut, and then, that causes an increase in these estrogens in the bloodstream. Also, the microbiome has to do with the metabolism of your testosterone. It can influence progesterone, but it just causes an imbalanced regulation, and the endocrine system is quite sensitive, or it can be disrupted even by antibiotics and steroids and these toxins that we get exposed to.
One thing that I actually thought was very interesting was listening to someone talk about estrogen and estrogen dominance, and one of the ways that happens is with constipation. So when you're in dysbiosis and you've got constipation, you've got all of these toxins, including all of these hormones that should be secreted to create balance throughout the body. And instead now you're creating these other, disproportionate hormones because you're not having a regular bowel movement, which kind of leads us on to the next part is, how do you know if you have a problem with dysbiosis? And essentially, this is where we're talking about your bowel habits. Like, are you pooping regularly? What does your poop look like? What should it look like? Essentially, we're looking for a smooth, sausage-like, and brown in color is a good poop to have.
Right. Yeah. I recently heard a podcaster talking about, that if you had trouble with your dysbiosis and your bowels and what you eat, is it that you have logs and rocks, or do you have tea, or do you have snakes? So it's, that kind of hits home. It's kind of descriptive, but yet, you know what I'm talking about. So, but, these symptoms of dysbiosis just take on all kinds of forms, but, the constipation, diarrhea, bloating, gas, abdominal pain, they're pretty common issues.
Right. And then also looking at changes. We all know that everybody is different. And so everybody's going to have a little bit different schedule and a different rhythm. But when you start seeing changes, that's a pretty good indication that there is a problem. And oftentimes, if you're really paying attention, you might be able to correlate, like, what did I eat, or what was I exposed to, and that caused these changes when you're really looking out for it. But I do think that a lot of people just think it's normal to have diarrhea every once in a while or constipation. And the truth is, even though it's common, it's not normal.
Right. And, look at the situation. Everybody, if you've traveled and gone anywhere for an extended period of time, or even an overnight deal, it's certainly something. If you do travel, you're going to upset that biome, with what we eat. Maybe your change in your activity, stress. So all those affect that. And so, that's a simple sign that, yes, that's how dysbiosis happens, and have that happen on a chronic, everyday basis, and that starts to affect your overall health.
So there are a few things that we can do to even test the microbiome. And one of those things would be a stool analysis. That is a test that we provide a kit, and you take that home with you. You do the collection and then send that off for testing. And when you get that back, it will tell you, which bacteria you might be low in or have too much of. There's also a food inflammatory test it's a blood spot test. Similar, you do that at home and send it in, and it will give you information about your microbiome too.
Yeah, it's about the sensitivity. It doesn't have to necessarily be you're allergic to foods. People think, well, I can't eat that because I'm allergic to it. That's not necessarily true. It could just be more of a sensitivity. And, what is that? Is it because the gut lining is got some troubles or problems, and you don't tolerate these well? You don't make the enzymes or enough enzymes, or is there a genetic predisposition? So those things are something that we can go through and try to figure out what's going on.
So once you've identified that you have a problem with your microbiome, what are some things that you can do to improve it? And there are a lot of things that you can do, starting with exercise. When you increase your exercise, you improve your gut motility just from the fact that you are moving your body.
Yeah, that'll help reduce constipation without question. It's going to help improve, gas and bloating and inflammatory bowel symptoms. It's just those irritable things that happens, and that's how, exercise can change that around, and just in modest amounts of exercise, not excessive, but just modest amounts on a regular.
Yeah, I think that is key, that it is a regular movement on a regular basis. I heard Dr. Casey Means talking the other day about how our current thought on exercise is, I got to go to the gym and get my workout in, and then I'm good for the day. But the truth is, our bodies were made to move all day long. So although it's great to get that one workout in, I'm not saying don't do that at all, but make a point to get up and move your body several times throughout the day. Even if it's just standing next to your desk and doing some squats or whatever. Maybe it's taking a walk, which would be even better, because then you're getting a little bit of a break from sitting and this, looking at the walls of your cubicle, so to speak.
Right. But all this exercise is just basically going to help you to improve your good bacterial microbiomes. The good guys that help us to protect our linings. It decreases our gut permeability, which is eventually going to improve your nutritional absorption, which will help, help your overall health and wellness.
And then kind of a second stage, yoga is a great way to exercise and move the body. It really does work the gut, but it also reduces stress, which is another great thing to help improve your gut health. And meditation kind of goes hand in hand with yoga a lot, but both of those things would be really good to help with stress.
Right. Meditation is really key. A lot of folks just don't do that. And it's okay, but you need to take time to have a way to reset, reduce stress, even if it's just forming a 3 box breaths. Sit down in a nice quiet environment, take some big deep breaths and blow them out and blow out the steam. So,
no pun intended.
Right. You can blow that way too, I suppose.
So the next thing is nutrition and what you can do nutrition-wise, how you're going to feed your body to improve your...
Right. So, dietary and lifestyle support with just diverse, rich fiber diet. Those good bacteria love that fiber. And that's basically our prebiotics and probiotics, which there's a lot of different types of probiotics out on the market. But there's also the fermented foods, various different types of, sauerkrauts and kimchi and things like that.
Kombucha, kefir.
Right.
Lots of ways to get fermented food.
And then there's the polyphenols, which are basically a variety of different colored foods and the vegetables and sugar, or vegetables and fruits. So what we want to avoid are the sugars and the starches and all these processed carbs. Those things just feed the bad bacteria.
So just a quick note on the polyphenols, the idea of eat the rainbow. So make sure that you're eating a wide range of colors of vegetables, and that will help make sure that you're getting all.
Right. Yeah. We just basically, you need to think of trying to get your fruits and vegetables as more of a whole food, and instead of getting it out of a can, but also it's certainly something that's going to help kind of maintain that good quality microbiome that we need. We need to make our fruits and vegetables more of our main course, and instead of it being a afterthought, something to add to our food source. But, let's avoid also, we have to avoid the pollutants and the toxins, especially the toxins from some plastics and, these glyphosates, which are basically herbicides. That's in a lot of things. And, your cattle are eating these grasses and things that we're putting these glyphosates on. And so that stuff gets into our system too.
So there's also different supplements that you can take to kind of help. And we talked a little bit about that earlier with the pre and probiotics. We recently started taking Akkermansia, and we have really felt like that has helped us a lot. Another kind of part of that is the GLP-1.
The GLP-1 production is really key. I mean, obviously there's the Ozempic and the GLP-1 agonists that are out there, but your gut wants to produce GLP-1. It does that. But what do we need to do to try to encourage that? Well, that's taking care of our good gut bacteria. The GLP-1, it actually has anti-inflammatory effects to it. In these smaller doses, it'll help. It reduces your appetite, and it's going to improve your insulin sensitivity, but also improves your gut barrier integrity, which is that leaky gut permeability that we don't want.
And then as far as medications, there has also been some evidence that shows metformin could benefit the gut microbiome and the gut barrier function as well.
Right. So as you can see, there's a lot of topics here. There's a lot of things that our gut is vitally important for. It's a major contributor to our health. And you've as a conductor have just simply got to do what you can to conduct your symphony orchestra to produce the best outcome. So what you can do as a human to help your own GI tract is just going to help improve your quality of health and your and your overall mental and physical health.
So yeah, I think that's a good place to stop for today. And if you have any questions, please reach out, revelationhealthandwellbeing.com, and keep following us. Let us know what you want to hear more about.
We appreciate you listening. Have a healthy day.
Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.